If you have Medicare, are approaching Medicare eligibility, or are helping a parent or loved one with healthcare decisions, there is something you need to know about 2027. Medicare is not standing still. Important changes are being prepared for 2027, and some of those changes could affect how beneficiaries compare plans, use prescription drug coverage, and think about their healthcare expenses. And here's the important part: you don't need to wait until 2027 to start paying attention. The decisions you make during Medicare enrollment can affect which doctors you can see, which prescriptions are covered, what your premiums look like, and how much you may have to pay out of pocket. That's why today's video is about preparation. We're going to walk through the major Medicare developments for 2027, explain what they could mean for beneficiaries, and discuss some of the mistakes people should try to avoid when reviewing their Medicare coverage. This is not about panic, it's about preparation. Let's start with the big picture. Medicare has several different parts, and one of the biggest sources of confusion is the difference between Original Medicare, Medicare Advantage, and Medicare Part D. Original Medicare generally includes Part A and Part B. Part A generally helps cover certain hospital and inpatient services. Part B generally covers medically necessary doctor services, outpatient care, and other covered medical services. Then there is Medicare Advantage, also known as Part C. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They provide Medicare-covered benefits through the private plan and may include additional benefits depending on the specific plan. Then there is Part D. Part D provides prescription drug coverage, and this is where many retirees need to pay close attention. Prescription coverage can vary significantly from one plan to another. A medication you take today may be covered under one plan but treated differently under another. Your pharmacy may be preferred under one plan and not another. Your premium can change. Your deductible structure can change. And your out-of-pocket expenses can depend heavily on the specific coverage you choose. So when you hear that Medicare is changing in 2027, don't assume there is one single change affecting every beneficiary in exactly the same way. Medicare is a huge system. Different rules apply to different parts of the program. Your personal experience can depend on your plan, location, prescriptions, doctors, income, and healthcare needs. Now let's talk about one of the major developments for 2027. The Centers for Medicare and Medicaid Services, or CMS, has finalized policies for Medicare Advantage and Part D for calendar year 2027. CMS says the finalized policies are designed to improve payment accuracy, strengthen accountability, and support the long-term sustainability of Medicare Advantage. The agency also projects a net average increase of 2.48%, or more than $13 billion, in payments to Medicare Advantage plans in 2027. But there is an important distinction. A change in payments to Medicare Advantage plans does not automatically mean every beneficiary will see their premium increase by exactly the same amount. Your personal plan costs can be different. Medicare Advantage plans are private plans, so premiums, benefits, networks, and cost sharing can vary. This is one of the biggest reasons why reviewing your plan every year matters. Many people choose a Medicare plan once and then simply keep it year after year. That may feel convenient. But convenience can become expensive if the plan changes while you aren't paying attention. Imagine that you have a Medicare Advantage plan today. You like your doctors, you like your pharmacy, your prescriptions are covered, everything seems fine. Then the plan changes its network or prescription coverage for the following year. If you never review your annual notice of change, you could enter the new year assuming everything is exactly the same. Then you discover that something important has changed. Maybe your preferred doctor is no longer in network. Maybe a prescription moves to a different tier. Maybe your copayment changes. Maybe a benefit you use frequently has new restrictions. This is why Medicare enrollment should not be treated as a simple checkbox. It's an opportunity to review your coverage. Now let's talk about Medicare Advantage quality ratings. CMS uses a star rating system to help beneficiaries compare the quality of Medicare Advantage and prescription drug plans. These ratings can consider areas such as health outcomes, patient experience, access to care, and other quality measures. For 2027, CMS has finalized changes to the star rating system. The ratings are not designed to tell you that one plan is automatically perfect. They are one piece of information that can help you compare options. Think about it this way. Price matters. Benefits matter. Doctors matter. Prescription coverage matters. but quality information matters too. A plan with a low monthly premium may not be the best fit if your doctors aren't included or your medications are expensive under that plan. At the same time, a higher premium does not automatically mean better coverage. The goal is to look at the complete picture. Now let's move to prescription drugs. For many retirees, prescription costs are one of the biggest parts of the healthcare budget. Medicare Part D has been undergoing major changes in recent years, largely because of the Inflation Reduction Act. One major change was the introduction of an annual out-of-pocket limit for covered Part D drugs. This is important because beneficiaries who previously faced very high prescription costs now have a defined annual limit for covered Part D out-of-pocket spending under the applicable rules. But don't misunderstand what this means. A maximum out-of-pocket limit does not mean every prescription becomes free once you reach that amount. It means covered Part D out-of-pocket spending is subject to an annual limit, and not every healthcare expense falls under Part D. A doctor's visit is not the same as a prescription drug. A hospital stay is not the same as a pharmacy prescription, and services covered by Medicare Advantage can have different cost-sharing rules. So don't look at one Medicare number and assume it represents your entire annual healthcare budget. It doesn't. Your healthcare expenses may include premiums, deductibles, copayments, coinsurance, prescriptions, dental care, vision care, hearing services, transportation, and other expenses depending on your circumstances. Now let's talk about something you should do before choosing or renewing a prescription plan. Check your medications. Don't just check the names. Check the exact medication, check the dosage, check how frequently you take it, check your pharmacy, and check the plan's formulary. A formulary is essentially the list of prescription drugs covered by a plan, along with information about how those drugs are treated. Two plans may both cover the same medication, but place it in different cost-sharing tiers. That can change what you pay, and if you take several medications, small differences can add up over an entire year. This is why Medicare shopping should be based on your actual situation. Don't choose a plan simply because a television advertisement says it offers extra benefits. Don't choose a plan simply because your friend likes it. And don't choose a plan just because the monthly premium sounds attractive. Your friend's prescriptions are not necessarily your prescriptions. Your friend's doctors are not necessarily your doctors. And your friend's county may not have the same plan options. Medicare is personal. Now let's talk about Medicare Advantage networks. This is another area where beneficiaries can be surprised. A Medicare Advantage plan may have a network of doctors, hospitals, specialists, and other healthcare providers. Before enrolling or changing plans, check whether your important doctors are included, and don't only check your primary care doctor. Think about specialists, think about hospitals, think about the healthcare system you prefer, think about the doctors you may realistically need over the next year. A plan that looks excellent on paper can become frustrating if you have to change a doctor you've trusted for years. That doesn't mean network restrictions are automatically bad. Many people are comfortable with them, but you should understand the network rules before choosing. Now let's discuss enrollment. CMS has finalized changes aimed in part at streamlining certain enrollment processes. That might sound like a technical government issue, but enrollment rules can have real consequences. Missing an enrollment opportunity can sometimes lead to delays, penalties, or gaps in coverage depending on the circumstances. That's why people approaching Medicare eligibility should not wait until the last minute. If you're approaching age 65, start learning about Medicare before your enrollment window arrives. Know when your initial enrollment period begins. Understand whether you have employer coverage. Understand how your current insurance interacts with Medicare. And don't assume that a friend's or relative's experience will automatically apply to you. Your situation may be different. Now let's talk about one of the most common Medicare mistakes, focusing only on the monthly premium. You may see a plan advertising a $0 premium and immediately think, this must be the cheapest option. Not necessarily. A $0 premium does not mean zero healthcare costs. You could still have copayments, coinsurance, deductibles, network requirements, prescription costs, and other expenses. The better approach is to consider your likely total costs and coverage needs. Ask yourself, how often do I visit doctors? Do I see specialists? Do I take several medications? Are any of my prescriptions expensive? Do I need regular laboratory tests? Do I have ongoing healthcare needs? Do I travel frequently? Do I spend part of the year in another state? Do I need access to a particular hospital? Do dental and vision benefits matter to me? These questions can be much more important than simply looking at the monthly premium. Now let's talk about travel. This is especially important for retirees who spend a lot of time away from home. Original Medicare generally has different rules from Medicare Advantage when you receive care outside your normal service area. Many Medicare Advantage plans have networks and specific rules for routine care outside the plan's service area. Emergency and urgent care are different situations, but routine care while traveling can be more complicated. So if you travel frequently, understand your plan's rules before choosing coverage. This is one of those things that may not matter until the day you actually need care, and that's exactly why it should be considered in advance. Now let's return to prescription drug costs. Another important development is the continued implementation of Medicare's prescription drug price negotiation program. The federal government is negotiating prices for certain high-spending prescription drugs covered by Medicare. The negotiated prices are being introduced in stages. The broader goal is to reduce what Medicare and beneficiaries pay for certain expensive medications. But this does not mean every prescription will suddenly become cheaper. The negotiation program applies to selected drugs under specific rules. If a medication you take is affected, the impact could be meaningful. If it isn't, your costs may not change because of that specific program. Again, focus on the medications you personally take rather than assuming a headline applies to everyone. Now let's talk about Part D premiums. CMS has released preliminary information for 2027 Part D bidding, but the amount a beneficiary actually pays can depend on the specific plan and the official annual figures. So be careful with headlines claiming that every Medicare beneficiary will pay one exact amount. Medicare costs vary, plan premiums vary, income can matter, and certain beneficiaries may pay additional amounts through income-related adjustments. When planning your 2027 retirement budget, use the current official figures rather than simply copying last year's numbers. Now let's talk about income-related Medicare costs. Some Medicare beneficiaries pay higher Part B and Part D premiums because their income is above certain thresholds. These additional charges are commonly associated with the Income-Related Monthly Adjustment Amount, or IRMAA. This can surprise retirees. Someone may expect to pay the standard Medicare premium only to discover that their income places them in a higher premium category. And this is where retirement planning gets interesting. Certain financial decisions can affect your income. For example, selling investments, taking a large taxable distribution, or converting money from a traditional retirement account to a Roth account can affect your taxable income. Depending on the timing and applicable rules, that income may affect Medicare-related premiums in a later year. This does not mean you should never make those financial moves. It means you should understand the possible consequences before making them. Retirement planning and healthcare planning are connected. Now let's discuss Medicare Advantage extra benefits. Many Medicare Advantage plans advertise benefits beyond what original Medicare generally covers. Depending on the plan, these can include dental, vision, hearing, transportation, fitness programs, over-the-counter allowances, and other benefits. But benefits can change. A benefit you receive this year may be different next year. The dollar amount may change, the participating providers may change, eligibility requirements may change. There may also be limitations that aren't obvious from a short advertisement. So don't assume that a benefit shown in an old commercial will automatically be available in 2027. Read the official plan materials, look at the details, and if something is unclear, ask before enrolling. Now here's another common mistake. Choosing a plan because of one attractive benefit. Maybe one plan offers a generous dental allowance. That sounds great. But what if your prescriptions cost significantly more under that plan? Or what if your preferred hospital isn't in network? The extra dental benefit may not make up for those disadvantages. This is why Medicare planning is not about finding the plan with the longest list of extra benefits. It's about finding coverage that fits your actual healthcare needs and financial situation. Now let's compare Original Medicare and Medicare Advantage. There isn't one option that is universally best for every beneficiary. Original Medicare generally provides broad access to healthcare providers that accept Medicare. Medicare Advantage plans can operate through provider networks and may bundle additional benefits. Some people value the flexibility associated with original Medicare. Others prefer the structure and additional benefits offered by a Medicare Advantage plan. Some people prioritize access to specific doctors. Others prioritize predictable costs or additional benefits. Your priorities matter. And remember that Medicare supplement insurance, commonly called Medigap, is a separate option for people who have original Medicare. Medigap policies can help cover certain costs that original Medicare doesn't fully pay, depending on the policy. Medigap is not the same thing as Medicare Advantage. Understanding that difference is essential. Now let's look at Medicare from a broader retirement perspective. Healthcare costs are one of the biggest uncertainties in retirement. You may know how much Social Security you expect to receive. You may know your mortgage payment. You may know your utility bills. But healthcare expenses can be much harder to predict. That's why your retirement budget should include a healthcare category, and that category should be broader than just Medicare premiums. Think about prescriptions, dental care, vision care, hearing needs, specialists, possible procedures, transportation, and unexpected medical expenses. Nobody can predict exactly what healthcare costs will be in the future, but you can prepare for uncertainty. Now let's talk about what you should do when Medicare enrollment season approaches. Start by making a list of your current doctors. Then make a complete list of your prescriptions, including dosages. Write down the pharmacies you use. Review your current plan's premium and cost sharing. Check whether your doctors and hospitals remain in network. Review prescription coverage. Look at deductibles, copayments, and coinsurance. Review the plan's major benefits and limitations. And finally, compare the entire picture instead of focusing on one number. This process may take some time, but it can help you avoid unpleasant surprises later. Now here's a question many people ask. Should I change my Medicare plan every year? Not necessarily. You don't have to change just because a new year begins. If your current plan still meets your needs and remains affordable, staying with it may be perfectly reasonable, but you should review it. That's the key difference. Reviewing does not mean changing, it means checking. If nothing important has changed, you can make an informed decision to stay. If something has changed, you can compare alternatives. That is much better than automatically switching or automatically staying. Now let's talk about scams. Medicare beneficiaries can be targeted by misleading advertisements, fraudulent calls, and people pretending to represent government programs. Be careful if someone pressures you to make an immediate decision. Be cautious if someone unexpectedly asks for sensitive personal information. And be especially careful if someone tells you that your Medicare benefits will disappear unless you provide information immediately. Don't allow pressure to determine your healthcare coverage. Use trusted official Medicare resources to verify important information. Your healthcare coverage is too important for rushed decisions. Now let's think about people who aren't on Medicare yet. If you're in your 50s or early 60s, you may think these changes don't matter yet, but learning about Medicare early can make the transition much easier. Start understanding the different parts of Medicare. Learn about enrollment periods. Understand how employer coverage interacts with Medicare, and include healthcare expenses in your retirement planning. One of the biggest retirement mistakes is planning every dollar of retirement income while barely thinking about healthcare. Don't make that mistake. Now let's bring everything together. What should retirees and future retirees remember about Medicare as we move toward 2027? First, Medicare Advantage and Part D policies continue to evolve. Second, Medicare Advantage quality ratings and other program rules are being updated. Third, prescription drug coverage remains one of the most important areas to review. Fourth, the annual Part D out-of-pocket structure provides important protection for covered prescription spending, but it does not cover every healthcare expense. Fifth, Medicare Advantage networks can affect which doctors and hospitals you can use. Sixth, plan benefits and costs can change from year to year. Seventh, income can affect Medicare premiums for some beneficiaries through IRMAA. And eighth, choosing